Millions of people across India are currently navigating the daily realities of diabetes and hypertension. Treating these chronic diseases requires decades of strict dietary adjustments, continuous blood monitoring, and consistent trips to the doctor, expenses that quickly pile up. For the poorest populations in urban and rural Tamil Nadu, paying for that continuous care is mathematically impossible. A highly manageable condition turns fatal simply because the patient's bank account runs dry. The biology of high blood sugar or elevated blood pressure is only part of the threat. The true crisis is the severe socioeconomic inequality in who can actually access sustained medical intervention. Enter the Nalatham Trust. Registered in 2019, this organization was built with a single, uncompromising mandate: to deliver high-quality medical care exclusively to the most vulnerable individuals. To date, they have provided over 13,000 medical consultations to these communities. Every single one of those visits cost the patient absolutely nothing. Nalatham anchors these efforts at the Free Friday Clinic in Pallikaranai. As this clinic flyer details, they provide consistent, reliable testing for blood glucose and hypertension completely free of charge. This intervention requires rigorous follow-up. The Trust maintains continuous management for over 500 patients, relying on direct, face-to-face care to keep their vitals stable. These aren't one-off interactions. Nalatham has built a consistent clinical pathway for people who otherwise have no way to pay for chronic disease management. Operating continuously since the COVID-19 lockdown, the Pallikaranai Clinic alone has served over 8,500 patients. During these visits, doctors provide comprehensive support by physically handing over the actual medicine required to keep chronic conditions in check, entirely absorbing the cost. To ensure patients stay on track between visits, the Trust developed a digital care model. Doctors monitor patient progress, track glucose levels, and guide lifestyle changes through a dedicated WhatsApp group over a strict 6-month period. This digital integration enables daily management of chronic diseases, maintaining patient oversight between weekly clinic sessions. Because many vulnerable individuals lack the transportation to reach Pallikaranai, Nalatham bypasses the geography altogether and takes the healthcare directly to their streets. Through extensive mobile medical camps, they've treated over 3,500 patients across 7 locations, from urban Velletri to rural Krishnagiri. For the elderly and immobile populations living in these remote areas, this is often the only face-to-face medical consultation they will receive all year. These camps effectively dismantle the physical and logistical walls that prevent the poorest demographics from getting a simple, life-saving screening. Beyond direct clinical care, the Trust organizes community survival initiatives, recently contributing 50 units of life-saving blood to the St. Thomas Blood Bank. They also actively work to prevent chronic disease before it starts, launching citywide health mobilizations like the Beat the Sweet Marathon. As this newspaper clipping from the event shows, the marathon drew thousands of participants, educating the wider public on diabetes prevention through fitness. Nalatham fights the epidemic on 2 fronts simultaneously, actively treating those already afflicted, while educating the healthy on how to protect themselves. But standard charitable interventions face a harsh ceiling. A free initial consultation provides a critical starting point, but managing diabetes or hypertension demands lifelong pharmacological support. Many patients get a diagnosis and the starter medication, but eventually fail in their treatment because they cannot afford the ongoing commercial price of these daily drugs. To achieve true healthcare equity, there has to be a permanent, economically sustainable mechanism to provide heavily subsidized drugs year-round. That is why Nalatham is securing a license to build a John Oshadi pharmacy in Velletri. This specific facility will provide vital anti-diabetic and anti-hypertensive medicines to the poorest populations at heavily subsidized rates. This pharmacy serves a critical dual purpose. It secures affordable, continuous medication for patients, while the modest revenue creates a self-sustaining funding engine for the Trust's free clinic operations. To build this infrastructure, they rely completely on public support. The blueprint is ready, but the foundation requires immediate funding. Scan the QR code on your screen to donate to the Nalatham Trust today and ensure this lifeline stays open for the thousands of people who depend on it.